Hi, I'm Barrett from Mechanics Orthopedic Massage Therapy here in New York City, and today we're talking about treating orthopedic conditions with massage therapy from a neurological perspective. We did a post briefly before about why we would do that, and in this one we're going to talk about how that sort of happens. When we're treating this way, the idea is that the body has all of these mechanisms that it uses to sense what's going on in the body. And so we want to use those mechanisms to send back an afferent signal that things are okay. It might have pain sensory sensitivity, it might be sensing movement, it might be sensing where you are in space. It's comparing that data to what happened to you previously when you were doing those things, heat, temperature, all kinds of things. So we want to use what the body's bringing back up to the brain to our advantage, rather than thinking about massage as a passive thing where I'm gonna, do this treatment to you and that is going to be the sum of a total of fixing something. We're gonna break it down to just a few specific things, and I'll kind of give you some examples. Take for instance somebody who has a Achilles tendonitis. We're not gonna look at it from a tendonitis point of view, but we're going to look at it in terms of how the body decided to deal with that. And it's got a little bit of heat and swelling at the heel in this case, and also peroneal longus and brevis are very tight and splinted, and the Achilles is immobile. They're not able to move the leg. We've got gastrocs and soleus, very painful, tight, also splinted. So I want to look at that and I want to send an afferent signal back up to the brain saying things are okay. So I'm going to get the client into a relaxed state first, which is going to help with the parasympathetic symptoms. And then we might look at normal behaviors that the body would do. So long as this is safe for the person, they've already been cleared, that it's okay to treat, I want to mimic what is a normal behavior for that Achilles at that time. So maybe they can't actually move it, it's too painful at the joint. So I would then take the muscle and try to bow it from side to side gently, and then maybe have the person do a tense and relax with the gastrocs and soleus. So while I have it bowed, they just tense up that muscle. So now we're signaling to the body there's a little extra length there, and we're getting that muscle pump going. And that might or might not send a signal up to the brain, hey, look, there's normal behavior happening in this Achilles, gastroc soleus area. We've got the muscle pump going, there's circulation getting in there, and the muscle seems like it's lengthening, contracting, even though it's not actually lengthening, contracting, because they're not moving the joint. And so at that point, the body might take and drop the pain signal a little bit for you, and then you might be able to recover a little bit of range of motion. Once you get that range of motion up, then you would be able to look at that again and say, hey, can you move it through that range of motion? Let's just do a little active range of motion, and they've got a little bit there. Then you might look at it again and say, okay, how about adding a little bit of resisted range of motion in there? And so that's a really great example of how we would look at something like Achilles tendonitis from a neurological perspective. It's not about the treatment that we are doing. It's not a rote memorized treatment like X, Y, and Z works for this. You're looking at the sum of the symptoms and then trying to go muscle by muscle and figure out how you can send an afferent signal back to the brain that the situation in that area of complaint is a-okay. We can go through some other treatments at a later date. In the meantime, you can find out more information about us at bodymechanicsnyc.com, or you can go to 315 Madison Avenue in New York, New York, and find out a little bit more about us. Thanks so much for tuning in, and we'll see you next time.